Hi, I'm Matt Otto from Crossroads Psychological Associates, and I'm here with my partner, Dave Gold.
Hi, like Matt said, I'm Dave, and I'm a psychologist at Crossroads Psychological Associates. We've been doing a couple of these kind of fireside chats, just talking about what's been going on in the pandemic. Matt, what have you been noticing about some of your patients and specifically stress and anxiety?
Yeah, well, I think we've hit a point uh, in where people are starting to get a little tired of being shut in, right? That it was novel for a few weeks, and then we had some crisis moments, and now there just seems to be this like underlying anxiety and depression, kind of low level that's simmering. People are getting a little stir crazy. I know my kids are getting a little stir crazy. I'm sure your kids are getting a little stir crazy. We're all dealing with that. But one of the things that you said last time we talked was you talked about the lion charging and how we're all dealing with anxiety. And so one of the questions I've had the past week or so is from people who don't normally deal with anxiety, like some of my depression clients and those sorts of things, is what does that anxiety look like? They're not used to it. They're not used to what the normal is of anxiety. What are some symptoms you're seeing?
Well, they're the obvious ones, just feeling stressed and nervous and things. But for a lot of especially my teenagers and young adults, it's coming out as frustration. It's coming out as anger, being irritable, just kind of, getting angry at little things. Um, and, being a little bit, less open to resolving it and just wanting to stay anger.
Hmm.
That's the thing about anxiety. It's going to come out and it'll come out in this direction. And if you stop it from coming out here, it'll just come out here. It's almost like playing emotional whack-a-mole.
Right. And it can also come out so differently for different people too, right? So yeah, you're right. A lot of folks are expressing it through anger, but I know some folks that I work with are having a hard time focusing. They're these little
Yep.
tasks they know they
Yep.
should be able to get done, and they're taking them 2, 3, 4 times as long as it would normally take them to get them done. And they're getting so frustrated and overwhelmed with themselves and with the situation, and going, "What's wrong with me?" This is normal for dealing with anxiety.
Yep. It also affects sleeping patterns, and it's weird because it can go in either direction with that. It can prevent you from going to sleep, wake you up in the middle of the night, or, I have some where they're just sleeping all day. It's almost like they're shutting down.
Hmm. Hmm. Absolutely. Headaches are not uncommon. Stomach aches are not uncommon. It's going to mess with how you eat. So a lot of people have had really big changes in their diet here recently, and how your body processes food, even, right? So I know some folks I work with are saying, I've still been working out, I've been exercising, I've been doing all these things, but I'm not losing weight the way I wanted to. This is still that time of year where people are still thinking about trying to get into their beach bodies, right? And hoping that
I
we can
stopped
all get
thinking
to the
about that years ago, Matt.
beach. I want to insert a comment about seeing you in a beach body, but I'm going to bite my tongue. But people are trying to do that this time of year, despite the pandemic and despite being home, and getting really frustrated when they're not losing weight, despite doing these healthy things. And that a lot of that could be anxiety, that our bodies are just they hold on to extra weight when we get anxious. Some people don't eat enough and lose a lot of weight during periods like this, and that's all
Well,
normal.
yes, yes. When we feel anxiety, when our bodies experience anxiety, we go into fight or flight. Our bodies get prepared to either run away to save ourselves or to fight to save ourselves. But in either way, there are some real physiological changes that happen in our body, and our bodies start reacting and processing things very differently. So you're absolutely right. You're absolutely right. You
Yeah.
also talked about difficulty concentrating and focusing. Um, I've had people being more forgetful, um, feeling more disorganized.
Hmm.
It comes out in a whole bunch of different ways.
It does. It does. And one of the things that we've come to understand as a profession over the last 20 to 30 years is that Depression for a lot of people is the opposite side of the coin from anxiety. So some of those folks
Yeah.
who I work with who have dealt with anxiety for a long time, and now you add another layer of anxiety with all of this crisis that's going on, and they're just shutting down, and the symptoms they're having are more classic depression symptoms, like you said, sleeping too much, eating too much, getting overly sad, having a hard time getting motivated. Those are classic depression symptoms that can come because of an overload of anxiety.
Very well said. I absolutely agree. So, so all this is happening. What are some ways for people to deal with the anxiety that they're feeling? Again, it's not abnormal or pathological to be feeling anxiety when we're locked at home in the middle of a pandemic, but we still
Mhm.
have to deal with it.
Yeah, yeah, we do. And there's lots of different ways to deal with it. I think what you said earlier about this being a fight or flight mechanism and knowing that this is a biological response is important, because then we can look at, well, what are the ways that I can send the message back to my brain to relax? What are the ways that I can send the message back to my brain? There's not a lion waiting for me outside of the door that's going to pounce. I'm really safe, even though there's all this crazy, we're still safe. Um, so how do we trick our brain, or train our brain to realize that there's not that lion there? And that can be things like breathing exercises, taking some real slow, deep breaths. It can be a muscle relaxation exercise. It can be a grounding exercise where we do a body scan of how we're feeling. Are we carrying stress in our head or in our stomach? Where are we carrying our stress? It can be getting out and exercising. It can be doing a project that we understand really well. Some people who are mechanically minded can go, work on in their shed or in their garage on a mechanical project to get back into their frontal lobes, because when we get fight or flight, we're in our midbrain, right? So if you work on a project, you're doing some
Right.
problem solving, you're getting into your frontal lobes, and that can help get you out of that anxiety mindset as well. So there's lots of different ways to go about it. What I tell people is that most of the folks I work with find 2 or 3 things that work really well for them. Maybe it's doing that project. Maybe it's exercising. Maybe it's deep breathing. Maybe it's mindfulness. But they find those 2 or 3 things that work really well for them, and those are their go-tos. And they go to that on a regular basis to make them feel better. And then I tell them these other things that maybe work for other people and don't work as well for them. Keep them in your back pocket. And especially during a crisis time like this, where we feel like just taking deep breaths often and it's just not working the way it normally does. Well, now's the time to reach into your back pocket, pull out some of those other things that you wouldn't necessarily go to, and go work in the yard for a little bit, or work in the garage, or do that breathing exercise that normally is not as effective for you. So I've been encouraging folks to do those sorts of things.
That's a really good point. It's not just that different things work well for different people, but different things work at different times for each of us. So if
Mm-hmm.
it didn't work in some other circumstance, that doesn't mean it won't work now.
Right.
There are 2 other ways that I'll talk with people about trying to deal with anxiety. Our nervous systems, from the time we are born, when we're infants, what our nervous systems are hardwired for is to reach out to another and to be emotionally regulated, to be soothed, to be calmed down by reaching out to another and connecting with another. This is what children do with parents. This is what spouses and romantic partners do with each other. This is what friends do with each other. It's very tempting. I'm terrible at this. If I get stressed, anxious, frustrated, my first reaction is to kind of pull back and isolate. But what's healthier, what we are built to do, is really to reach out to other people and connect. Okay, there are plenty of studies that show just having another person there next to you will actually calm down our bodies, will calm down our brains firing in certain kind of anxiety centers.
Mm-hmm. Yeah, that's a really good point.
The other thing that I'll talk about is the feeling that our lives are out of our control, that we're just kind of helpless and being thrown about by circumstances. It was very anxiety provoking and kind of predisposes you towards depression. So if you can put in things, even just like a pretty simple schedule that allows you to have control over something, allows you to manage something, that just snowballs and helps you to feel that your life is a little bit more in your control.
Right.
And that's less frightening.
Yeah. It's also a good chance for those who are religious to go back to your religious texts and prayer times and those sorts of things, which can also help ground you and give you a sense that even if you feel out of control, that maybe there's a higher being out there that does have control.
Right. I think that's a great point. As you come up with other ideas, other things that work for you with managing anxiety, share them with each other and share them with us.
Yeah, please put them in the comments below. We'd love to hear more. Thank you for listening, and we'll try and do this again in a week or two.
Everybody stay safe.